right. Today, up first, we have Dr. Kelly Ballantyne. She graduated from the University of Illinois College of Veterinary Medicine. She began her career as a primary care veterinarian in the Chicago suburbs before joining the University of Illinois' satellite veterinary practice in Chicago in 2009. She is board certified by the Veterinary College of She is board certified by the American College of Veterinary Behaviorists and is a clinical assistant professor at the University of Illinois College of Veterinary Medicine. In addition to consulting on behavior illnesses in dogs and cats, her research interests focus on the human-animal bond and how having a pet with a behavior problem impacts an owner's life. Please join me in welcoming Dr. Kelly Ballantyne.
Thank you so much for having me here today. I first want to thank our conference hosts. This has been a really wonderful experience getting to be at SPARCS 18 and enjoying all of the other presentations given by our presenters over the last 2 days. And I'm also really looking forward to Dr. Heckman's presentations later on today. My main focus of interest, as Julie just mentioned, is on the human-animal bond, and my work is primarily in consulting with pet owners on behavior problems, whether that be with their dog or their cat. So I primarily work with companion animals. And so I'm coming at my presentation from that framework. So I really care about the human-animal bond, and in my day-to-day work, in any given week, I'm seeing approximately 20 different families in person and consulting on the problems that they're dealing with their companion animals. And in that work, I get to see the human-animal bond at its very best, and I also see the human-animal bond when it's under significant strain. So in most cases, that strain is caused by the pet's behavioral problem. And we might see that behavioral problem, after we have time to talk to the clients, we might find that it's actually a normal behavior, but it's unacceptable given the pet's current environment in their home. Or in some cases, we actually see that it's more like what we'll call a pathologic behavior. So the behavior is extreme given the context, or it might be shown in more intensity than expected given the situation. And we see a lot of animals that are in chronic states of fear and anxiety. And that's a welfare concern for those animals, and it's also impacting the quality of life of their humans, which, as Julie mentioned, is my main area of research interest. So given all of that, what you're going to see from me today is I'm going to talk a lot about canine behavior, and I'm going to give a little splash of canine behavioral genetics in here because that's not truly my area of expertise, but it is an area of interest. So as Dr. Miklosi and Irizarry had mentioned on day one, if you were able to see those presentations, the process of domestication and artificial selection has evolved dogs into our best friends. I mean, they are our canine companions, they share our homes with us, and they've been evolving to share our homes with us over the past many thousands of years. They are just one of many different types of social canids. So their close relatives include not only the gray wolf, who they've evolved from, but also the coyote and the golden jackal. And because they're social animals, they have many ways of communicating with each other in order to signal their intent. They might be able to signal when they want to play or when they're perceiving a threatening situation. And this is really important for animals that live in social groups so that they can manage behavior and avoid aggressive interactions or conflicts with one another and live harmoniously together. So as both Dr. Miklosi and Dr. Irizarry had mentioned on Friday, there are a lot of differences between the gray wolf and the domestic dog that shares our home with us. So there are morphological differences, such as wolves having larger skull sizes and bigger bones. We also have physiologic differences. So dogs have evolved the ability to digest starches. And as Dr. Wade mentioned yesterday, the reproductive patterns of these two animals are now different, where we have wolves primarily reproducing on an annual basis and most breeds of domestic dogs reproducing on a biannual basis. There are also significant behavioral differences, and this is something that is not necessarily known in the general public, so a lot of people assume that dogs are very similar to wolves and can make some false assumptions about how to manage their dogs based on what they think they know about wolf behavior. But wolves, in fact, live in family packs, and they cooperatively raise their young, and they cooperatively hunt for food, whereas domestic dogs generally do not live in family groups. So groups of feral dogs are generally unrelated individuals, and they might cooperatively hunt, but they also primarily scavenge. And then the female dog, she's on her own in terms of raising her litter. So there's no cooperative raising of young in the domestic dog. So there are lots of behavioral differences. Dr. McLosey also highlighted some of his really interesting research on the cognitive differences between gray wolves and dogs, where gray wolves seem to perform better in terms of observational learning, whereas dogs seem to be better at reading our gestures and responding to human signals in terms of performance. I'd also like to point out that despite dogs sharing our homes with us, they are not human children dressed up in dog costumes. So they are their own specific species, and they have their own specific needs as well. They have a different way of even perceiving the world around them. So as many people know, dogs' primary sense is their sense of smell. And while they are obviously visual creatures, their sense of vision is also actually different from ours. So we are really good at seeing fine details, whereas dogs are actually better at detecting motion. Dogs also, most breeds of dogs are also able to hear at higher and lower frequencies than we do. So they see the world in a different way. The dogs that share our homes with us really depend on us for their health and well-being. And if we think about it, we really control almost everything about their lives. So we control when they eat and when and if they go out to exercise, and they really depend on us for their entertainment. So they're really at our mercy in that sense and depend on us to make sure that we're fulfilling all of their needs, both physically and behaviorally. So it's really interesting to think, previously, I think many people would assume, of course, dogs are capable of a wide range of emotions. But back not too long ago, there was some question on whether or not animals could actually experience or feel emotions. And this is important when we think about drivers for behavioral problems or just how to best care for our companion dogs. And this is a model that I really rely on when I'm communicating to pet owners about dog behavior. This is called the ladder of aggression, and it was developed by Dr. Kendall Shepard, who's in the UK. And so the ladder of aggression is a great model that shows how a dog's behavior in response to a threat is going to change in intensity based on that dog's perception. So we have behaviors that are low on the ladder of aggression, and those are labeled with the green coloration. So we have things such as yawning, blinking, and nose licking, or turning the head away, or shifting the body away. And so these are subtle signals where dogs are communicating, I'm uncomfortable and I need some space. Now, if that signal is not met with the appropriate response, so we have a dog that is yawning and blinking and nose licking, and the interaction with the other individual continues, and the dog is still perceiving it to be a threatening situation, it is going to escalate up this ladder of aggression, basically to get the point across. So we can see dogs escalate up the ladder of aggression in one specific context, so in one interaction with an individual, but we can also see dogs escalate up this ladder of aggression given their learning history. So some dogs may have learned that yawning, blinking, and nose licking is not effective at ending interactions that they find unpleasant, so they might throw those behaviors, maybe not completely eliminate them from their behavioral repertoire, but start using behaviors that are a little bit more effective, such as baring the teeth, growling, or snapping. So it's important to recognize that these are actually all normal behaviors in a dog's repertoire. Aggression is actually just part of normal canine communication, and it's not necessarily something that's black and white, like bad or good. Growling and showing the teeth are important warning signals for us as humans to recognize and acknowledge, rather than just thinking, oh, this is a bad behavior, my dog must not growl, that's totally unacceptable. This is normal canine communication. So as many of our other lecturers have discussed over the past couple of days, dogs have been purpose-bred for thousands of years. So we've selected specific or certain types of traits in different dogs to breed dogs of different working abilities. So we have dogs that hunt, we have dogs that herd, and we have dogs that guard flocks. And as Dr. Wade mentioned yesterday, certain desirable traits such as herding ability can be selected for to increase the working ability of dogs. But as Dr. Carlson mentioned yesterday too, sometimes undesirable traits are also highly heritable. So that means we can get we can increase the prevalence of certain undesirable traits if we breed dogs that have undesirable traits to one another. And there's some, one of the things that as a behaviorist that I'm always focused on is just the heritability of conditions such as fear and anxiety. And while fear is also a normal emotional response, it is protective. We need to be able to experience fear of threatening situations because that helps to protect us from harm. We have a spectrum of fear and anxiety in all animals. So we have some dogs that maybe show high levels of fear versus other dogs showing low levels of fear in the same context. And there is some research to suggest that fear and anxiety are also heritable. Now, a lot of this evidence comes from some really interesting studies that were done back in the 60s and 70s in the German short-haired pointer. And this group of researchers was actually trying to develop the dog as a model for studying human anxiety disorders. And so what they did is they had these dogs and they were raised in a laboratory environment, and they wanted to create a stable line and an unstable line of dogs. And so they selected fearful dogs and bred them together to develop their unstable line. And then they just selected pointers that were showing a normal range of behavior to represent their stable line. And they raised these groups in the same environment, they treated them the same, and they also put them through the same battery of behavioral tests. And what was really interesting I was reading these studies, the researchers had said that they thought it was going to take several generations to develop this unstable line of pointers, but it actually happened fairly quickly. And they also found that the signs of fear and anxiety on those behavioral tests cropped up at a very early age. So they started testing the puppies from these litters as early as 2 to 3 months of age, and then they continued testing them throughout 2 years of age. Based on the descriptions in these studies, these dogs were displaying what I would consider pathologic levels of fear. So they did one test where they tested the dog's response to a loud noise. And the normal dogs would startle, which would be a natural response to a loud noise. But the dogs from the unstable line would typically freeze, and they would remain in that frozen posture, sometimes for a few minutes, but in a couple of cases, it lasted even like almost an hour, hour and 15 minutes. They also made some comments that they found that the dogs from the unstable line had difficulty behaving in novel situations. So one of the examples they gave is that they changed the bedding, the type of bedding in one of the dog's cages. They put the dog in it and the dog remained in a frozen state for, again, over an hour. So this is a pathologic level of fear. It is no longer serving a purpose for the animal. It's actually interfering with its ability to behave normally. There are many other studies from this group on this line of pointer dogs, But one of the other ones they did is they took the unstable line and the stable line and they did some crosses to determine how those hybrids would react in the line of behavioral tests that they were doing. And what they found was that while the crosses were they behaved less fearfully on that battery of tests, they were more similar to the unstable line than they were to the stable line. So it's just interesting to think how strong fear and anxiety was in this particular line of pointers. Now, there's fear and aggression is something that gets researched very frequently in clinical behavior medicine, and there's been some interesting studies just trying to look at heritability of other issues such as aggression. And one of these studies was actually done in golden retrievers, and you might think, oh my gosh, like golden retrievers could never possibly be aggressive. And it's true that in this group of golden retrievers that they looked, there was a low rate of aggression. They did find high heritability in terms of aggression directed towards humans as well as aggression directed towards other dogs. The more work needs to be done on this, however, because this was a very small group of dogs and they were closely related to each other, so that might actually falsely elevate those heritability rates. And if we looked at larger groups of golden retrievers, we'd probably see those heritability rates come down. Some other groups, and this is primarily done with working dogs, have looked at other traits that could potentially be heritable. And this is a study that was done in Sweden looking at Swedish working dogs. And so they assessed a large number of German Shepherds as well as a large number of Labrador Retrievers and assessed a variety of traits to see if they can determine the heritability of those traits. And what I found interesting was with this study is that they found that sociability or willingness to interact with humans had a moderate heritability for the German Shepherd dogs, but not really for the Labrador Retrievers. It was very low for the Labradors. So what they took from that is that sociability or willingness to interact could probably be selected for within this particular line of German Shepherds, but selecting for that in Labradors probably wasn't going to change the trait very much. Now, yesterday, Dr. Carlson mentioned a little bit about coat color and its potential and how sometimes coat color can be associated with other traits, such as deafness in the boxer dog. And this has also been looked at in the behavioral literature, but the evidence is a bit confounding. So back in the 1960s, a group looked at aggressive behavior in English Cocker Spaniels. And in their data set, they did owner surveys and generating behavioral scores in terms of aggression based on some of these ratings. And what they found was that the solid color Cocker Spaniels were more likely to demonstrate aggression compared to the party color Cocker Spaniels. So those are Cocker Spaniels with a mixed coat. So they found that in about 12 of 13 situations, these solid color Cocker Spaniels rated as more aggressive than the party colors. They then split the data up and they found that the red or the golden coated Cocker Spaniels were rated as more aggressive than the black Cocker Spaniels in about 10 of the 13 situations that they assessed. So this was really interesting to a lot of researchers, so it's been looked at a few other times. And so in the 2006 study, a group looked at Cocker Spaniel puppies. And they did some behavioral tests on Cocker Spaniel puppies at 7 weeks of age. And they found results similar to the 1996 study. So they found that in their data set, the golden colored Cocker Spaniels behaved more aggressively than the black coated Cocker Spaniels and then the party colored Cocker Spaniels. Following that, Dr. Amat, who's at the School of Veterinary Medicine in Barcelona, so her group did a retrospective study of the dogs that they were seeing in their clinic for behavioral consultations. So they wanted to look at their data set and see, is it more likely that Cocker Spaniels are using aggression compared to other dogs? And what they found was that when they compared Cocker Spaniels to each other, so they're all presenting to the same clinic for behavioral problems, they found that the English Cocker Spaniels with a golden coat were more likely to show owner-directed aggression compared to Cocker Spaniels of different colors. They also found that Cocker Spaniels were more likely to show owner-directed aggression compared to other dogs of other breeds presenting to the same clinic for aggression. But what was really interesting about this study is that they also asked about where these dogs were coming from, so where the clients had been purchasing the pets. And something that is confounding this is that the red Cocker Spaniels were more likely to have come from a pet store compared to the Cocker Spaniels of other coat colors. So we really can't say based on this data that, oh my gosh, red Cocker Spaniels are a really big problem. Coming from a pet store can significantly affect a dog's behavior as well. So it's really hard to make any generalities or judgments based on coat color given this information. Now, an interesting study that they did to follow up is they wanted to look at the Cocker Spaniels in their group and determine if they could figure out any differences from dogs showing aggressive behavior of other breeds. And this is a really small sample size, but they did find that there were lower levels of the serotonin neurotransmitter in the Cocker Spaniel serum compared to dogs of other breeds. So that potentially gives us information about a difference or a change that we can further investigate to see if we can figure out where this is coming from and potential treatments for these dogs. And that leads me to my next point, which is that genes really aren't about inevitability, they're about potentials and vulnerabilities. So keep in mind with all of those Cocker Spaniel studies, especially the one from Barcelona, those red Cocker Spaniels were coming from a pet store environment. So their experiences are going to be different from dogs that are maybe coming from breeders or coming from other sources. So genetics is not determining everything. And Dr. Heckman's going to talk a lot more about this afternoon. We have to think about the other moderators of behavior. And the first thing to consider is just the maternal and the rearing environment of the dog. So we would consider puppies in a litter such as this where the mother is well taken care of, it's a clean environment, she has adequate nutrition, and she has help in raising those puppies. The humans in her household are helping to raise those puppies. And I just want to point out that this little one right here with the purple collar is actually one of my dogs. So compare that to this mother who is living as a stray and she doesn't have necessarily appropriate nutrition, or she's having to seek out food on her own. She doesn't have any help in raising that litter, and she's potentially living in a dangerous and stressful environment. So all of these experiences that are happening to the mother are also going to affect the behavioral development of her offspring and affect future behavior. Health and nutrition is also another moderator of behavior. And we should not only consider just an animal that is receiving balanced nutrition compared to animals that are undernourished, but also sometimes overnutrition is going to affect behavior. If we have a dog that is what we will sometimes term nicely as overconditioned, they they may be less motivated to engage in training in order to earn food rewards because food is just readily available all the time. We also have to think about how physical health conditions might affect behavior. And this is something as a veterinarian and as a veterinary behaviorist, I am constantly screening my patients for, because chronic medical conditions that cause pain or discomfort or affect normal behavior, they're gonna affect normal behavior. And I would say, I haven't run the numbers on this, which I should do, but I would say just if I was gonna estimate it, about 20% of my patients have some sort of underlying medical condition. And those medical conditions in most cases are not the primary cause of the behavior, but they certainly exacerbate the behavioral condition. And I always try to relate this to my clients and just thinking about, if you have a chronic condition such as arthritis that causes you pain, or you have a condition that creates itchy skin, you're going to be more irritable than you would be if you were feeling well, and you might react differently in situations than you would when you're feeling well. Early life experience is another moderator of behavior. So this is why a lot of veterinarians and shelter workers and people who work with breeding dogs really stress the importance of early life socialization, because the experiences that dogs have anywhere from 3 weeks of age up to 12 and sometimes 16 weeks of age are actually going to significantly shape their future behavior. And so it is really important when we're raising young dogs that we give them the appropriate types of learning experiences that they'll need for their future lives. So if we have a young puppy that's going to be living in a city, he or she is going to need to be exposed to that city environment, the noises that they might encounter, and interact with a number of different people and dogs in order to be a behaviorally healthy adult. And we have to consider, what a dog's behavior who has a growing up experience like this, where they're taken out and they're given positive experiences with a number of different environments and unfamiliar people and dogs, compared to a young dog such as this that is maybe chained up in the backyard and has limited interaction with unfamiliar people and never gets out into another environment. There are studies back to Scott and Fuller that show if we isolate young dogs or we limit their exposures, once they're adults, they are going to be more prone to things like fear. They were just never exposed to novelty when they needed to, and novelty is often scary. And then a big thing that we have to consider is the animal's ongoing learning experience. And I have to say that this is usually my main focus when I'm treating behavioral issues in companion animals, because by the time the dogs come to see me, I've had no control, and neither has the pet owner, about the maternal or the rearing environment. We have no control over the early life experiences in most cases, so we really focus on what the animal's ongoing learning experiences are. And all animals will repeat behaviors that either get them desirable consequences, something that serves them a function, or that get them away from undesirable consequences, so allow them to escape from threats. So when we're treating behavioral problems, we really focus on trying to manage the home environment and their experiences so they're not put into a situation where they're continuing to repeat unwanted behaviors, because practice makes perfect with undesirable behaviors as well as with desirable behaviors. So we really got to control the environment to avoid that unwanted learning experience. It's also really important just in terms of managing that animal's level of fear and anxiety if that's something that they're experiencing. In addition to careful environmental management, we're also focused on reinforcing or rewarding behaviors that we want. So if we want a dog to come to us, we might figure out what that dog really loves, whether that be a piece of food or an opportunity to play, and deliver that consequence when we see the desirable behavior. And this is what helps us to not only treat behavioral problems, but also create really lovely companions. Now, there are a wide range of training modalities that are out in our society. And as Dr. Wade was mentioning the other day, things like electronic shock collars are actually illegal in certain countries, but here in the US, they are still prevalent and still used quite often in training dogs to behave, or to train them not to engage in certain behaviors. And it is true that all animals will also learn to decrease behaviors if they have an undesirable consequence. So if you deliver a painful consequence when your dog does something that you don't like, that dog may learn to stop that behavior. But it can be very problematic to use those types of training methods. And as veterinary behaviorists, we do not recommend using correction as a mode of modifying behavior, because the science tells us that there is a lot of fallout to using those types of training training techniques. So here are just a small sample of the literature that has been done on training and how that affects behavior. And if we look at the Blackwell and the Heron study, so Dr. Emily Blackwell did a survey of pet owners, and she assessed not only the training methods that those owners were using, she also assessed the number of undesirable behaviors that the dogs were engaged in. And what she found on this owner survey was that the dogs that were trained exclusively with positive reinforcement. So those are dogs that are rewarded for desirable behaviors, and the owner said that they either gave them a treat or praised them in response to desirable behaviors. Those dogs had the lowest scores for problematic behaviors that we might call aggression. She also found that the dogs that were trained with positive punishment, so those are dogs in which an undesirable behavior is responded to with a physical correction or perhaps a verbal correction. And what she found in that study is that those dogs actually rated the highest for problematic behaviors such as aggression. And so her study really showed that, yeah, there's a difference, and sometimes when we use punishment-based methods, we're perhaps increasing the risk for undesirable behaviors rather than actually treating the issue at hand. Now, Dr. Megan Heron did a similar survey study when she was doing her behavioral residency at University of Pennsylvania. And so what they did in this study is they evaluated dogs that were presenting to the behavioral clinic. So these are dogs that were coming to the University of Pennsylvania for behavioral problems, and they surveyed what types of training methods the pet owners were using. And they had a wide range of responses. So some people were using physical corrections, including pinning down the dog onto its back, which was a very popular training method at the time. Other dogs were yelled at in response to unwanted behaviors, and some were getting physical corrections, such as by a leash or a collar. And what Dr. Heron found in her study was that using confrontational techniques such as yelling at the dog, even just yelling at the dog, or using physical corrections such as that alpha roll were associated with higher rates of aggression directed towards the owners as well as directed towards other humans. So again, we have some more evidence that's showing that, you know, the type of training method used matters, and using harsh training methods increases the risk for problematic behavior. Now, these were both survey studies, but the Schilder study that was done in 2004 was what's called an observational study. So in this study, they actually assessed dogs that were trained with the use of a shock collar, and these were working dogs. And so they compared two groups of dogs. There was one group of dogs that was trained using a shock collar. The other group of dogs was not trained using a shock collar. And they did videos of these dogs in several different situations. So they looked at the dogs in the training context. For the dogs that were trained with the shock collar, they also videoed the dogs when an electronic shock was actually delivered. And then they looked at the dogs outside of the training context when they were just interacting with their handlers, perhaps on a walk or walking around a field. And what this group of researchers found was that when an electronic shock was delivered, those dogs did respond with behaviors which are consistent with pain, such as yelping or lowering their body position to the ground. So while there can be differences in sensitivity to electronic shock in this group of dogs, they certainly responded as if they were feeling pain. They also found that the dogs that were trained using the electronic shock collar, when they were in the training situation, they showed more stress-related behaviors compared to the other group, and that was primarily identified with their lowered ear position, as well as some oral behaviors such as lip licking. And then what was really troubling was that when they looked at the videos of these dogs, when they're interacting with their handlers outside of the training situation, they also showed that those dogs showed similar stress-related behaviors. And so that leads us to suspect that those dogs made an association between the training method used and the handler. So this is a concern for me as a clinical behaviorist, because that shows that these types of training methods can definitely affect the human-animal bond and change the way that animals feel about the people in their homes. So I am ending a little bit ahead of time, but I guess just to conclude, it's important to remember that dogs are dogs. They're not human beings, and they have their own needs. They communicate feelings and emotions differently than we do, but we can tap into their language. So just because they might behave differently than we do in certain contexts doesn't mean we're totally lost. If we can learn to understand their body language and catch those subtle signs of fear and anxiety, then we're really well prepared to address our animals' emotions. If we can see that they're looking worried, well, then we can assess the environment around us and figure out, okay, what might be going on that's worrying our pet, and then change the situation in order to either help them navigate that situation or remove them from that situation, so they don't have to learn they need to escalate to using aggression in order to get themselves out of that context. And then there has been some work that has identified that, desirable traits are heritable, but undesirable traits are heritable as well. And as Dr. Carlson said yesterday, there's some evidence of high heritability of compulsive disorders in dogs, which is a really serious behavioral problem in the dogs that are affected and affects their quality of life as well as their owner's quality of life. And then we also have evidence that things like fear and anxiety are heritable. But that's not the whole picture. We have to consider that there are a lot of other influences on behavior, the maternal rearing environment, the animal's health and nutrition, their early life experiences, as well as their ongoing learning experiences that are going to affect that animal's behavior. And while many of us get our dogs and we have no control over the dog's genetics and we have no control over their early life experiences, we can absolutely help to control their ongoing learning experiences in order to treat or prevent unwanted behaviors. So in the second part of my talk, I'm going to be talking a lot more about the human-animal bond and some studies that are related there. But with that, I will wrap this first part up.